Hi, I'm Deb Cathcart, the Chief Nurse Executive here at mHealth, and I'm here today with the 5B Unit Council to talk with them about some of the work that they've been doing to continue to improve patient care. And so with that, we'll get started. Well, one of the goals of the Nursing Council is really to engage and empower staff to be making improvements on their unit and be driving improvements in patient care. So I'm wondering, what is one of the process improvement projects that your team has been working on recently?
Well, one thing that our council wanted to work on was improving our falls rate. And so based on our data that we found, most of our patients that were falling were liver failure patients. So when we are assessing our liver failure patients, we use a scale called West Haven criteria. And there was also a new technology that we started using called VPM, Video Patient Monitoring. And so we used those two scales, the VPM and the West Haven, we combined them in a way to prevent falls.
Well, as you work on these important process improvement projects, we do know that collaboration with other team members is really important and a high value here within the organization. Can you talk a little bit about the collaboration that you did with others?
Yeah, so this project was really a collaborative effort. First, we worked with our CNS to kind of go over all of our falls data and determine that the liver failure population was really one of the greater populations that was falling. And we also worked with our CNS to look at, once we implemented the intervention, kind of how our falls had changed, our fall rates. We also did a lit review and worked with the library resources, looked at different articles to kind of see what was already out there in the literature about preventing falls, like bed alarms and hourly rounding. There wasn't a whole lot about video patient monitoring because this is a newer effort and a newer intervention. We also brought up our project to the Falls Committee and also the VPM team as well.
Well, I'm thinking there's a lot of other nurses and individuals who work with us who have not heard about the West Haven criteria. Can you tell us a little bit about how you found out about it and researched it and determined it was appropriate for use?
So with the West Haven criteria, they're given a score between 0 to 4, and we use that to grade them about where their mentation is and about how much lactulose they'll need given that. So we were looking at the West Haven score, and we paired that with our new fall assessment that we had initiated.
Mm-hmm. Yep, and so I guess one thing that I'm just wondering is, as you've implemented this, and it sounds like with this patient population, to help kind of define a little bit more about those patients that are at a higher risk for falls, who have some underlying disease condition.
Mm-hmm.
But how do you interface this with our usual standard work around falls assessment?
So our unit council worked with the falls team, and this isn't replacing any of the fall precautions that we already use, but it's a new additional assessment that we have in place.
Well, as with all process improvement, one of the things that we look to is making sure that we have outcomes, that we know that we're making a difference. So I'm wondering, with this project, what are some of the outcomes that you're measuring, and if you have results, what are they showing?
Sure, yeah, our primary measurable outcome was the fall incidence in our liver population. So in order to evaluate that, we worked with our clinical nurse specialist, Shamsa, who helped us get the baseline data for our fall rates, and we compared that to our post-intervention data. After the intervention, we had a lower fall rate in our liver failure patients, but we did notice that at the 3-month time period after the intervention, we had the same fall incidence rate with our overall patient population. So that's leading the council to look at other more general ways to assess fall risk.
So I'm just wondering as well, with the data measuring, how are you knowing that your outcomes are being sustained, or are you doing ongoing monitoring?
Yeah, so the next phase of the project is to monitor the 6-month data post-intervention, so we can see if the beneficial effects of this intervention are lasting, or if they're going down and we need to do additional work.
Well, and one other thing with our unit councils is we know that the involvement and support of the manager is really important. So I'm wondering, Sarah, can you talk to me a little bit about how you work with the council and empower them to get these results?
Well, I really see my role as the strategic kind of manager. I see the data, I hear the data from all of the leadership meetings that I attend. And so then I see my role as taking that down to the operations level with the council. And often that's data driven. And so I bring our falls rate data, I bring our patient experience scores, I bring all sorts of things, our pressure injury rate, that I get our CODI audits. And so I hand them over to the team and really let creativity run and support the ideas that they have to operationalize those then for the rest of the staff.
So I have one more question before we wrap up today, and I'm just wondering, from idea to implementation, how long did that take for the team?
We had the initial idea at a council meeting after reviewing some data and really had the good idea to continue the work in between council sessions. And so we used some of our extra time that were allotted in the council meetings to do some literature review and to keep going on the idea so that by the next time when we came back as a council, we were really ready to roll with the idea and get an action plan in place. And so I would say 2 months it took us from initial idea to then implementation with the staff.
Well, once again, I'm just so honored and proud to be able to hear about the work of the Unit Council. I think the work here on Unit 5B and what you heard about is just really another idea that starts from understanding what's happening on our units with the data, putting an idea in place, understanding and gathering information about that, acting, and then monitoring. And I know the team will continue to make adjustments to this work as they go forward because that is part of our PDSA cycle, is to just keep iterating and keep making changes as we improve care. So thank you so much to the team and the Unit Council for this ongoing work.